We must not balance the budget on the backs of the elderly, on the backs of the veterans, the children, the sick, and lower-income people. Deficit reduction is important, but it must be done in a way that is fair. That is what the American people in poll after poll are saying. And it is time for the Congress of the United States to listen to the American people and not to wealthy and powerful special interests and their lobbyists. Despite the enormous success of Social Security, despite the fact that Social Security can pay out every benefit owed to every eligible American for the next 21 years, my Republican colleagues in Congress and some Democrats are attempting to use the deficit crisis as an excuse to cut Social Security benefits. That is wrong. So we are here today to tell the White House and the leadership in Congress, do not balance the budget on the backs of the most vulnerable people in this country. Do not balance the budget not only on the backs of seniors, but on the backs of disabled veterans.
We're here to talk about one of the more perverse policy proposals ever to make its way into the halls of Congress, and that's the change CPI. As you've heard, that's a technical term for a cut in Social Security benefits, plain and simple. And the older you get, the more that cut hurts. $135 billion over the first 10 years. That's $135 billion that seniors won't have to buy food or to buy clothing or to pump into the economy to fuel this economy. And it's truly mystifying to me and the American labor movement overall why Social Security is the perennial target for deficit reduction when it has absolutely nothing to do with the deficit.
It's been put forward as a relatively easy, relatively harmless solution to reduce the deficit. However, this policy, as we've discussed, would have very negative effects on millions of seniors, retirees, working families, women, veterans, and the disabled. Change CPI would cut Social Security benefits by thousands of dollars over an individual's lifetime. And it's also important to note that current Social Security beneficiaries would begin to feel the impact of this change in the COLA virtually immediately.
This is the second time in so many months that we've been brought to talk about this, and that is totally insane to me, that we have to keep coming back and talking about how cutting benefits for veterans is not the answer to our fiscal woes. You know, you hear change CPI, you hear all these complicated policy terms. And really what you're saying is that we're going to balance the budget on the backs of those who have fought for us. And these proponents of the change CPI, they apparently are okay with that. And you know what? I'm not okay with that. They say, well, times are tough. You know what? Tell me about it. Tell me that times are tough. For me and my friends who spent the last 10 years fighting war. Tell the Gold Star widows and the surviving spouses how tough times are. Tell the Vietnam and World War II and Korean veterans who depend on their benefits to supplement their income because they're still suffering from wounds from their service. Tell that to the disabled veteran who has invisible wounds, who needs their veterans' benefits so that they can help recover. We lost more veterans last year to suicide than we did to combat. Tell those veterans about how times are tough.
Let me be clear, the change CPI is a betrayal of women in particular. The purpose and effect of instituting a change CPI is to shield the wealthiest from paying their fair share in taxes. It is hundreds of billions of dollars in cuts so that we can get to we can talk about balancing the federal budget on the backs of, as so many people have said, on the backs of working families, on the backs of disabled veterans, and let me say this, on the backs of women. 2/3 of minimum wage workers in this country are women. 2/3 of minimum wage workers in this country are women. And what is it that really characterizes minimum wage workers? No pension, no 401k, no health benefits. During their working lives, they are paying out of pocket for their own health care and their kids' health care, and they are not able to set aside any money for their savings. They get to their retirement years, and they are virtually exclusively reliant on Social Security.
Our nation's Social Security system is a lifeline for more than 56 million Americans, which include more than 10 million Americans who qualify because of a disability. It's a system that was built up over the years, over the decades, as part of our shared commitment to each other. And changing the benefit calculation with the so-called CPI isn't, as you've heard, just a technical adjustment. It's a painful cut that is going to hurt people with disabilities.
This reflects what tens of millions of people are feeling in their hearts. So I thank all of our speakers for being here.